So, after measuring the pH, volume, color and viscosity of the semen, next we have to analyze the sperm concentration. There are so many different types of sperm counting chambers are available in the market. The first and most still valuable sperm counting chamber is a hemocytometer, and next popular sperm counting chamber is macular counting chamber, which gives a very accurate sperm count and motility. In the modern time, we are using computerized assisted sperm analyzer, and after that there are so many sperm counting chambers are available in the market with a less price and more precise in giving the report. First we will see the sperm count. The sperm concentration is the number of sperms present per ml of the semen, and total sperm count is the number of sperms present per ejaculation. So, we will take 10 microliter of the semen and find 10 microliter of the semen drops in the counting chamber and observe according to the counting chamber specification. So, if the sperm concentration is less than 16 million per ml, then we call it as oligozoospermia. This condition is maybe due to varicocele or retrograde ejaculation. The clinician or andrologist will diagnose the problem of this male infertile patient. If it is more than 250 million per ml, we call it as polyzoospermia. This condition is mainly due to the long sexual abstinence gap. Suppose if there is no sperms, no live or dead sperms were observed in the chamber, we have to carefully examine the complete slide or the complete chamber and confirm that there is no live or motile sperms present. In this condition, we have to collect the complete semen sample in a conical centrifuge tube and mix it with equal volume of the semen with the culture media, mix it well and centrifuge at 1500 rpm for 5 to 10 minutes. Then decant the whole supernatant and observe the pellet completely with the chamber or in a petri dish under the very powerful magnification like 400x, and then confirm whether there is no sperm present in the whole sample. Then we have to give a report as azoospermia. So, this azoospermia condition may be due to obstruction in duct or hormonal insufficiency or congenital syndrome. So, in that case, we request the patient to give another sample within 1 to 3 month interval and confirm whether the azoospermic condition persists in the patient or not. So, for azoospermic condition, we have to do 2 semen tests consecutively and then we have to give the confirmatory report as azoospermia. And in this azoospermic condition, we have to check the fructose level, whether fructose is present or absent. In addition to the sperm, we also see some other cells in the semen like round cells, leukocytes, etc. So, round cells constitute around less than 5 million per ml, mainly immature germ cell like spermatogonia, spermatites, which may be present due to fever, radiation, if the patient undergo chemotherapy, and also if the patient takes cytotoxic drugs. And sometimes the prostatic cells and epithelial cells also present in the semen. Next we observe leukocytes. If the leukocytes are present more than 1 million per ml, we call it as leukocytospermia. And sometimes we can also see high amount of WPC, and we call this condition as pyospermia. Next we have to count the sperm motility. The sperm motility is categorized into 3 motility by WHO, that is progressive, non-progressive and immotile. Progressive motility includes fast and slow progressive motile sperm, which is more than 25 mm per second, and non-progressive is the sperm will move with less than 5 mm per second, but there is no forward progression, but circular or sidewise it will move. And the immotile sperm movement, there is no movement and it is not dead actually. It's, the sperms are live sperms, but it is unable to move. So, generally if the motility is less than 50%, we have to undergo vitality test, and if it is immotile sperms, completely immotile sperms like necrozoospermia, we have to undergo hypoosmotic swelling test. If it is more than 42% of immotile sperms are observed, then we call this condition as asthenozoospermia. This asthenozoospermia condition is maybe due to sperm structure defect, prolonged sexual abstinence, or varicocele, or presence of anti-sperm antibody in the semen. Necrozoospermia is a condition where 100% of dead sperms were observed, and this may be mainly due to cartilaginous syndrome or Celiac immotile syndrome.